everyone. I'm Dr. Terri Alani, the Texas Tooth Lady. And I don't know, I was just thinking, what can I do for the subscribers to make a difference? And I know a lot of you guys have many questions about dentistry. So I decided to open up a forum to where you can actually ask me any question that you want about dentistry, and I'll be more than happy to answer. So here I am, my first live YouTube. I don't know if anybody's watching, but I'm going to keep it up for just a little bit and see if any of you guys have any questions that you'd like for me to ask. So many of you have told me that you are embarrassed to smile, that you can't afford a lot of expensive dentistry, that you have questions regarding what the Snap-on Smile is like, how to get your smile back in shape. I know I have a video on Charter. That one's reached almost 1.5 million views. And does it hurt to get your teeth cleaned? How often should you get your teeth cleaned? There's so many questions that you guys have. So I think I'm going to start tonight. If you have any questions, any type of dental questions, just feel free to ask. This is free, guys. Free dental advice. You don't have to go into the dentist to do this. You can actually just jot down a question, and I'll be more than happy to answer all your questions. So basically, what I want to know is this something that you guys are interested in? Do you think that a live question answer type of forum is something that you would actually want? Am I available for online consultations? You know, in the state of Texas, unfortunately, we can't do online consultations. It's against the law. So most people just chat with me now or on my office or on YouTube. So if you've got a question, so the cost on Snap-on Smile. Okay, so I get a lot of questions about Snap-on Smile. It's probably my favorite thing to do. Snap-on Smile, we charge $18.70 per custom appliance. Now, you guys might think, oh my God, that's a lot of money. But when you really think about what a Snap-on Smile does, you can actually eat and drink with it. I know that there's a lot of knockoffs out there online. Brighter Image Lab is one of them. I absolutely don't like their product. You're spending like $1,500 and you can't eat with the damn thing. There's no one there to adjust your bite. You don't see a dentist. So with Snap-on Smile, we charge $18.70. It is a custom appliance. It is, you can see my dog in the background. That's Piper, a therapy dog. But it's not one size fits all. Our payment plan is Care Credit. So you can come in and you can apply for Care Credit and we'll take that. So that is like our in-office finance plan. Joe Fagan, how are you? My God. It's like I recognize all you guys' names, so this is kind of cool. Good evening to you as well. So if you guys send me a picture for Snap-on Smile, Tracy, yes, I can sort of decide if you are a good candidate. It really just kind of depends. We almost have to see you in person, but with like an iPhone pic, yes, I can actually try to decide if you are. The biggest thing is that people with really large teeth do not look good with a Snap-on Smile because it adds 0.5 millimeters to the length and to the thickness. So you really got to be a good candidate, and that's why mine always look great because I've been doing this for a long time. Tian, yes, I recognize all your names. I am actually having a great weekend. I'm so sick of this COVID. I don't even know what to say. You know, we have to wear all that crap in the office. We have to wear the face shield. We have to wear the PPE equipment. And so for me, every day that I don't get COVID is a good day. I don't know if any of you guys have had it or had family members that have had it, but I know it can be pretty serious. I also know that some people it just doesn't even affect. So dentistry right now is a tough one. I'm going to get the vaccine. I don't know what all you guys think, but I'm definitely going to get the vaccine, and I'm looking forward to it. Snap-on Smile, April, is not done in a day. So what we do is we make sure that you don't have any existing cavities. If you have a broken down tooth and there's no decay, then we don't have to mess with it. But if you have a broken down tooth, there's decay, we try to repair it conservatively, because we usually know that finance is an issue for a lot of our patients. So we do a full set of x-rays. You got to make sure your teeth are clean, that there's no decay. Then we scan and we design. We send it to the lab, Denmath. They're the only lab in the United States that makes the authentic Snap-on Smile. And then you get it back in about 3 to 4 weeks. The reason is I'm picky. So we send out previews. So we can actually see what the appliance will look like, and I tweak it. I want to make sure it is customized for our patients. So just to give you a little history, is I have been lecturing. I was lecturing for the last 4 years throughout the nation to other dentists to teach them how to do Snap-on Smile. So you've got to be really careful if you don't live in Houston that you go to a dentist that is very experienced. You can go to www.snaponsmile.com. And doctors or nursing are good question, Joe. Good question. So I've been pretty involved in the state of Texas. They don't look at dentists as doctors. I don't know why. So, I guess we're not healthcare professionals, but we are. So hopefully we are going to get the vaccine in the third group of the first tier. So we're keeping our fingers crossed. Now, I'm not making anyone in my office get the vaccine. It's like they're right if they don't want to get one, but I'm sure as hell getting it. So let's see. I can't say Briajana. Did I say your name right? You're planning to come for 2 veneers. However, you feel like your 2 front teeth and gums are uneven and want to get that fixed as well. That's easy. If you feel like they're uneven, we can either, if it's at the edge of the tooth, the bottom of the tooth, we can recontour. If not, if it's at the gum line, we take a laser and we just melt away that gum tissue and make your gums symmetrical. So it's not an expensive process. And recontouring, a lot of times I just do that free if you're getting veneers done. I like to take care of the patient. So great question. Christina, back on 2018, you did veneers on your top teeth, just 6. I would recommend, they didn't do x-rays, found out they were not certified, they ground your teeth. Yeah. So what we're doing now with veneers is we're doing minimal prep. We try to take as little structure off as possible. That's kind of what people want. Now, you can't do no prep, which means that you don't alter the teeth structure at all because they're going to look really bulky and the margins are going to be very thick. And so you can collect food there. But yes, we do minimal prep. And if they ground your teeth down, I would not recommend just 6. You want to do 2, 4, or 8, not 6, because when you smile, those canines are the most prominent teeth in your mouth, and you want to go one pass so it fills out the back of your teeth, back of your smile. So if you're going to do veneers, 2, 4, 8, usually not 6. If you don't think they look natural, unfortunately, you can always get them redone. The new materials are really lifelike, and it really does depend on who you use. So you've got to make sure that you use somebody that is very experienced, and the lab makes a heck of a lot of difference. I'm trying to scroll down because I got a lot of people that are messaging me. So this is kind of cool. Anyway, so there's a lot of different new techniques of mouthful. Mouthful, 8 teeth is not really a mouthful. Believe it or not, if you watch a lot of the newscasters on television, I know with all this election stuff going on that we just had, everybody's been watching the news, but if you watch, you'll notice that a lot of newscasters have their top teeth veneered, but not their bottom. So you don't really need to have full mouth. Now, Donald Trump, he's got veneers, I think. Veneers are crowns. He actually, whether you like him or not, the guy's got an amazing smile. Joe Biden, it looks like he's got crowns on his top teeth. He doesn't have anything on his lower teeth. And Kamala Harris, her teeth are very natural. They're pretty. They're not perfect, but she's got a really natural smile. So really what you want to do is when somebody looks at you, you want to make sure that it just looks natural. It doesn't have to be perfect, but just natural. You can come in for a consultation. You just call the office. Okay, so this is the cool part. We only charge $40 for a consult. $40, that's it. And I keep it low because I really want to take care of the patient. Now that, of course, doesn't count with the x-rays if you want x-rays. But just for me to take a look and spend time, it's only $40. And our hours were open. The best thing to do is go to my website, which is the Texas Tooth Lady, Dr. Terri Alani. We're open Monday through Friday. And just schedule an appointment. The girls in the office will be more than glad to provide you with a lot of information and also to take care of you. I am located in Houston. I'm located in the Galleria area in Houston, Texas. It's really easy to get to. And hang on, I'll show you guys. Piper, come here. This is my dog, Piper, that you see. Come here. She is a superstar, and she is a therapy dog. Come here. Ah. So I rescued Piper, and this is my dog, Piper. Can I have kissies? If you don't like dogs, you're not going to like this. But this is Piper. Take a look. Look at all the people. Look at them. You see that? There you go. And Piper is a therapy dog at the office, and she's very popular, and she's very tame. Can you guys guess what kind of dog she is? She is a part pit bull, and she's a rescue. But she's hilarious. Okay, April, you're in Maryland, so I can't help you. But if you can find a really good cosmetic dentist in Maryland, there are a lot of them. You can go through your dental society, ask for a referral. And Joe, probably the new elect Joe Biden will come to Texas to see me. Huh. I didn't vote for him. I'm not even going to tell you guys who I voted for, but we'll see how it goes. You know, Joe Biden's pretty calm, so let's just keep our fingers crossed. And yeah, maybe he'll come see me for his dental work. But his teeth are nice. I mean, what is he, 78 years old, and he's got crowns? He's got a great smile. So does Mike Pence. So all those guys, they do good. So I think a smile is really, really important. So Christina, you are very, very welcome. I just want to let you guys know how much I appreciate each and every one of you. I love what I do. I've been doing it for a very long time. And do you guys think it's a good idea? So I'm asking you because you guys follow me a lot. I think I might do this weekly and really answer all your questions. I mean, it's like, I love my job. So if I can help give you guys some advice, because it's very difficult to get a lot of honest advice these days, I would really appreciate your feedback. April said, hi, Piper. Yep, you got a little girlfriend. Yes, you do. The other thing I want to talk about were veneers. A lot of people ask me the difference between Lumineers and veneers. So Lumineer is really just a brand name of veneer. Lumineer is made by Denmat, which is the company that makes Snap-on Smile. They have a huge lab in California. Lumineers are great. They look amazing, and they are minimal prep. But I use Lumineers, and I also use a lab near my house, right near my office, right down the street. That's a boutique lab, and they are Emax veneers. So both Lumineers and veneers are Emax veneers. It's just Lumineer is a name brand. And just make sure if you're going to get your dental work done that you are with an experienced cosmetic dentist. So here's the deal. I tell people there's 3 things you don't discount. You don't discount parachutes, heart surgery, and dental work. All right? Those are the 3 things you don't discount because you get what you pay for. Joe, you're welcome. You have a great weekend too. Tian, it's a great idea to go live and answer questions maybe once a month. You know, maybe I'll do it weekly. I don't know. We'll see. Do you guys have any other questions? I've been on here 14 minutes and it's a Friday night. Not doing anything, except I will tell you, I've been watching a YouTube series called Netflix, not YouTube, called Bloodline. I don't know if any of you guys have seen it, but it's amazing. I binge watched it and I finished it last night. So tonight, I got to find something else to watch. Houston, the weather is kind of chilly tonight with this COVID thing. I used to be really social, not being able to really do much or go out as much as I'd like to. But anyways, so if there are no other questions, I'm probably going to sign off, but I'll probably end up doing this maybe once every week. Goldmine, hello. How can you become a client of mine if you need your touch to do great work? Ah, thank you very much. Anybody can be my patient. You just got to come to Houston. So I practice in Houston. We take everyone. I mean, everybody thinks, oh, she's got a YouTube channel and she does TV and blah, blah, blah. But we just accept every patient. And basically, all you got to do is just make an appointment. Just call. Now, I don't know if you just got on, but we're only $40 for a consultation, which is really cheap. And I keep my fees low for consults because we get people from all over the country, and it's just keep it low. And then if you get the dental work done, you get the dental work done. And we always do treatment plans, and we're very transparent. April, it was nice chatting with you as well. It's nice to connect with you guys. I'm really enjoying this. And so anyways, 15 minutes now in, and this is kind of fun. I'm actually upstairs at my house. I'm in my computer room. And I was just sitting here thinking, what the hell can I do tonight? Let me do a YouTube live. Do I do veneers? Yes, I do veneers. I love doing veneers. I'm actually a cosmetic dentist. I've been doing this for a heck of a long time. So I do a lot of veneers. I do fillings. I do everything, but my main interest is really cosmetic dentistry. So one thing I really do is we do simple bonding. It's very inexpensive to close gaps between your two front teeth. I post on Instagram and I get so many people that come in to see me for that. And that's like inexpensive. It's like $2.50 a tooth. You can get your teeth recontoured. That's really inexpensive. There's so many ways to enhance your smile. I don't know if I'm saying your name. Hakan, hi. How are you? I don't know where you live. I don't know where a lot of you live. I know April lives in Maryland. So I know the weather. Let's see. Christina, is it true if you don't get crowns on missing teeth, you experience bone loss? That's a great question. Well, let me explain that, Christina. If you don't get crowns on missing teeth, you can't get a crown on a missing tooth. You need to get an implant, and then you get a crown on top of it. So you could get bone loss because if you have a tooth that's missing, your other teeth on either side will shift. And when they shift, they might drop down. If it's a top tooth, it can drop down to hit a tooth that's not there. So it drops, right? And that can create bone loss. So it is true. If you have missing teeth, you really need to get them replaced. Now, you don't have to go to all the expense of an implant. You can get a snap-on smile, or you can get a Valplast partial, which is a partial that doesn't have all those ugly clasps and it's more cosmetic. A lot of my patients, they get overwhelmed. They think, oh my God, I've got to spend all this money on an implant, but you don't. There are other options to replace those missing teeth, and you can always get an implant later. So I hope that answers the question. A treatment plan, I was asked, is a treatment plan like a payment plan? No. The treatment plan is the treatment that we're proposing to you. So let's say you come in for a consultation and you need 6 veneers. We're going to list it. We're going to list the price. That's the treatment plan. A payment plan is how are you going to pay for it. So they're two very different things. Joe, you live in Pennsylvania. I used to live in Monroeville outside of Pittsburgh. Yep, I sure did. It's very cold up there, but and then my son went to school in Philly, and I love Pennsylvania. So fantastic. Macan, you're doing well. Cool Breeze, you are all the way West Palm Beach. Hey, that's where I'd like to be. I've been there a lot. I've lectured there. I love Palm Beach. It is so nice there. And let's see, how can you wear complete dentures? How often is it needed to visit dentists with them? That's a great question. So if a patient has upper and lower dentures, probably just once a year, and I'll tell you why. What you want to do is you want to check for oral cancer. You want to make sure one person every hour in the United States dies from oral cancer. So if you are wearing upper and lower dentures or a partial, whatever, you want to get checked. You want to make sure your gum tissue is healthy and there are no sore areas and that the dentures fit well. So great question. And let's see. Joe, you're outside of Philly. That's nice. Philly had some issues with the this election stuff, didn't it? Had a lot of issues. Goldmine, you're in Ohio, man. You guys are like everywhere. I'm sure that you're laughing at my Texas accent, but I can't help it. So, a little bit about me. I was born in Austin, Texas. My dad was a professor, and I grew up in College Station, home of the fighting Texas Aggies. So I am a Texas Aggie. And I went to dental school here in Houston. I did live in Pittsburgh, Monroeville, outside of Pittsburgh, growing up because my dad worked for an oil company. So I did live up north for a little bit, and then I've been in Texas ever since. I love Texas, and I'll tell you why. We didn't shut down. We're still open. Yes, I hope you guys are wearing your mask. Um, Let me say something about mask. Mask work. A lot of people say, well, they don't work, but they do work. And if they didn't work, I'd be sick all the time. We get so many people coming in before COVID with flu, with strep throat, with all kinds of stuff. You know, they're always spitting on us, all kinds of stuff. But we wear masks, and I never get sick, knock on wood. You know, they'll come in with the flu. So it's really important that you wear your mask and you social distance, and not a lot of groups, because that's the way you spread COVID. And God willing, we'll be over this virus hopefully soon. I think by next June, we'll be able to do our social activities. I mean, living in West Palm Beach, you got the beach there, so you're lucky. You know, Houston, we don't really have the beach. We got Galveston, but the water does not look like West Palm Beach. I can promise you that. And all right, guys. Well, I really appreciate talking to you. I am going to sign off, and I will post the next time I have a live chat. Get your friends. If any of them have any dental questions, I just love my job. So I'll probably start doing this maybe weekly. I'm just not sure, and ask a lot of the questions. So good night. Have a great weekend and stay safe. Bye.